Hi, everybody. For those of you that don't know me, I'm Shell from Fight Like Shell. And for those of you that do know me, hi. This is just going to be a video explaining my port and port access. Okay, so what she is doing now is she's sterilizing the area where she is going to plug in, I guess, into my port. So she puts all the sterilizing on there, agent or whatever you call it, and then she has to let it dry before she can actually access the port. We're just waiting for it to dry at this point, and we're kind of shooting the shit, talking about our day, how hard it is to deal with patients that are like me, who don't relax and who are panicking about a scan. My port looks huge right now, sticking out from underneath my skin. Most people's don't stand out as much as mine. I'm not sure why mine does. If you're worried about the port access hurting, they will give you a numbing cream if that type of thing bothers you. I don't use it though. All right, now here comes the fun part. She's going to find, locate my port, stabilize it, and then we plug in. And it's easy as that. So what she does is she holds it still, and then you can see those three little prongs, and she plugs in between those, right into the middle. You can actually kind of fill a hole that is in there. And now what she's doing is she's trying to get blood pullback. So once they attach to it and they have it accessed, they have to retrieve blood from it. Once they realize that they have access to blood, which means that it's in the vein well, then they reflush it. Mine is kind of a pain in the butt because as soon as they get blood pullback, sometimes it'll fight you a little. So it usually happens when they're having problems getting pullback with the blood is I have to practically do a little rain dance and beg for blood, or I have to move around a lot, lean forward, lift my arm, cough, do all of these different things. I'm not sure why mine does that. It might be because, I don't know, I've punched myself in it accidentally while I'm mopping, or I hit myself in it all the time, or because my body is just broken. But as soon as they get pullback, then they're going to completely flush it. Then once the site is flushed, then they will retrieve more blood from it, and then that's what they dispose of, because that, of course, has all the flushing and everything in it. Then they're going to go ahead and take the blood samples from it for my blood test. Usually after they do that, then they would set you up and plug in the chemo or dialysis or whatever it is that you are currently using your port for, whether it be infusions or that. So now we see she's flushing this, or at least she's trying to flush it. She's having a really hard time with mine this go around, and I think I start moving around here for her. And it was all because I got excited because she pulled blood back early. So I was like, oh, look at you. You got it quick. And then I jinxed her. So when she starts getting that going, then we'll go ahead and pull. Yep, there goes the arm lift. Sorry that this is a crazy cleavage shot for everyone. It was hot outside and hot flashes, menopause, I don't need to explain myself. You understand. It's hot outside. So after I do a few dances and I move around some, we finally get to retrieve what we need. Now, this doesn't happen to everybody. A lot of times it just kind of happens to me. But just because I have problems with it doesn't mean that you yourself will. And this right here is the least of my problems. So now we're good. She's doing a flush. Pulling back. See how after she did the flush, she pulled back into that same tube. And we're going to toss that. Now, what she just did there was, that's a clip that kind of stops the flow. Most IVs have that as well. If they're doing something and they need to stop a certain medication and do another one, then they will actually clip to stop the flow. Now, I had a lady once hook me up with potassium, and she had a saline flow that went with it, and she accidentally left the clip on the saline flow. And if you've ever had potassium infused into you, it burns and it hurts a whole lot. So that was super fun. But that wasn't at this hospital. That was at a different one. Okay, so now we're getting all the blood from the tubes, and it works just like when you access a vein. It's just way easier and way less painful. Yeah, my poor body was just giving her a really hard time. I felt bad for her because then she allows me to record her, and then she goes through struggling with this. So I think I made her a little anxious, but I didn't mean to. It just kind of happened. So she's getting the rest of her supplies. There we go. And it didn't show the blood going into the tube because some people get a little, I don't know, queasy with it. So now she's reflushing because we're almost finished. And then she's going to unplug from me here in a minute as well. Usually this process is not this long. It's super quick. But because mine was being a pain in the butt, it took a little longer than it usually would. I would say if you're going in and you're just getting a port flush, you're looking at like maybe 5 minutes in that chair. But yet, of course, like I said, because mine always causes problems, it goes a little longer. So now she's getting a little cutesy little Band-Aid. She's getting herself set up so that we can disconnect. And she unclips. That's it. Super duper easy, and it's way better than constantly being poked. So I have some pictures here for you to show the port, how it's used, and what's going on. This is a picture with all the attachments already on it. So I'll explain what each part is. All right, now the part I've circled here, this is where your port is in your skin. That's where they plug in to access, kind of where your port sticks out. This part is the attachment with the tail. By attachment with the tail, what I mean is the little purple thing you've seen her plug into my port with the tubes hanging off of it. That's what this all is. That is this right here. That's what that is. Now, the great thing about this is if you have any procedures coming up and or surgeries, MRIs, or anything like that, you can have your port pre-accessed and the catheter and everything kind of already sitting out. It'll all be sterilized, set up, and covered with a bandage so that you can already be kind of set up for it to be easily accessed. So this is another picture that just kind of shows you the workings of your port, where it is under your skin, and how it plugs in. So there are different size needles that will be used with this. Make sure that when you talk to your nurse, if you do decide to do the port, that you ask what size needle is used for yours. There is an inch, quarter inch, 3/4 inch. I personally use the 3/4 inch with mine. That's the depth that I need for my port. This is just me trying to give you a better view of mine so you can kind of see what it looks like underneath the skin. You can see the prongs, kind of what it is, what it kind of looks like on a person. Now mine does stick out more than most. My sternum and area and whatnot is, I guess, just bonier than most people's. I'm not sure. All right, so that was all of my info I can give you on ports, how mine is used. I hope that me struggling to have blood pull back from mine does not deter you from getting a port, because me personally, I think that it is easier. I think it's better. I think it's safer. It's way more sterile. Chemo, if you were thinking about getting a port due to having chemo, it's going to be your best option, because chemo is going to destroy your veins. And when you are constantly getting poked all the time, it's painful, it's annoying, you bruise. Me personally, the area around mine, the skin kind of just numbed out after a while. I never really had to use the numbing cream. It's not like getting poked with an IV repeatedly and then you have to sit in a certain position so that it does not bend, it doesn't hurt. It ain't like that. Like I said before, I will always, always, always be an advocate for the ports. I think that they're easier and they save a lot of time and pain. Bet you can see my peanutters back there. Say hi, Baydens.
Hi, got the kitten named Nightmare.
Yes, she got a kitten named Nightmare. And this is my goddaughter, Savannah. Hi. We're currently going on a gas station run to get some drinks and whatnot. But like I said, talk to your doctors and especially the nurses in your chemo office. Man, they are going to give you the best tips possible when it comes to a lot of this stuff. Sorry, there is a hair like over top of my face. It's kind of making me crazy. But yeah, get as much information as you can. Like I've said before, stay off the internet. It is not your friend right now. Talk to them, see if a port is a good idea for you, or if you choose to do a PICC line. I had a PICC line, like I said before. I have a nice little scar from it. I don't know if you can see it. It sucked. Didn't like it. Very uncomfortable. So if anybody has any questions, feel free to hit me up or comment. I will try to get back to you as fast as possible. But yeah, so that's all of it. Like I tell you every time,
And then
don't be coughing on each other. And if you are close enough to where somebody could cough into your mouth, you are making poor decisions. Back it up. And everybody be safe and take care of each other.